In this video, you will learn how to navigate the Clinician Planner, get a high-level overview of the patient's chart, and how to add patient documentation in the Axxess Home Health solution. First, we will go to axxess.com, either using Google Chrome or Mozilla Firefox browsers. To the top right, select Login. Enter your username provided by your agency and your password. If at any point you forget your password, you can select Forgot Your Password to get a reset link sent to your email. Then select Secure Login. You'll get a pop-up that is a disclaimer saying this is for business use only, and select OK. The first page you will see is your Clinician Planner. Across the top, you'll have your date and time, and if you allowed locations, you will have your weather for the next several days. The next tab up here is your patients. If you click this, it'll view any patients assigned to you. It'll give you their date of birth, the agency they're with, what home health platform it's on, and you can view their chart to go to their patient's chart. You can see here that I have many home health patients, and then I have home care patients as well. So anything within that user ID that you are subscribed to will populate on your Axxess Planner. The next is your Help button. It'll take you to the Help Center, and you can log out. The first main tile here is your schedule. So any visits that are scheduled to you for that day will populate here. If there's more, then it'll appear here. You'll have a drop down, a scroll bar here that you can go up and down and see additional visits. If you need to see other dates, you can click the calendar, go back to whatever dates you would like. You'll see a red dot to indicate that you had a visit on that date. If you hover above it, you'll see how many visits you had on that day. You can click in it, and it'll take you to the visits for that day. You can always go back to today and see any visits for the date. If I select this visit here, I can see it opens up the alerts. You can see the alerts by hovering over them on the side, but when you open it, it'll open the alerts here. You can start your visit documentation from here or see the patient's chart. Again, any visits that are scheduled to you, no matter what platform it's on, as long as it's within that user ID, will populate together on this page. So you can see down here for a different agency, for a different platform, or home care platform, I have another visit. They'll all come together here. When I select this visit, it will also select the visit on the patient's chart over here or on the map. I can scroll down and be able to see from my location versus the patient's location. I can get directions and be able to see how to get there. Okay. You have a green for your location. You'll have red for different visit locations. So you can see multiple visits there. And then it'll turn blue for whatever visit you're going to do. Whichever one selected will turn blue. If you forget those items, you can come up to the top here. You've got question marks in each section. That'll give you a key and tell you what each one means. Moving to the right, you have your HIPAA compliant messaging center. Again, if you are subscribed to more than one platform or are working for more than one agency, they'll all come together here. To the bottom right, you have anything that's been returned by your QA department. So if you hover over the last, hover over this red alert here, the last comment that was made will populate. You can also open your visit from here and be able to see whatever comments were made and why that visit was returned. Okay. You can move this around and still document in the background, or you can downsize it all together and document and then bring it back up. To go back to our Axxess Planner, to the top right-hand side, I can select Axxess Planner. I can also see any past due visits here. Again, you can scroll them up and down. You can sort from ascending to descending on this one or on your alerts. And then all the way to the left, any platforms that you're subscribed to will show up here to the left. So you'll select your agency name to be able to enter that agency's platform. Okay. Your dashboard, everyone always has the first 5 tiles. We've gone over this in previous videos, but you have the different videos here that you can go through and watch. You'll have a date and time tile, a messaging tile, and news and updates for current blogs. And then you'll have a My Scheduled Task. Everyone will have the My Scheduled Task button here. You'll have the patient name if you hover above it. We'll hyperlink. If there's a hyperlink there, it'll go straight to the patient's chart. You have an A for authorization. If you had any issues with your authorization for that patient, you'd see warnings here. Then the task has a hyperlink as well. If you click onto any one of those tasks, you can open and start documenting from here as well. And then your date. So you only see the top 5 for any one of these tiles. If you select more, this will open up your scheduled task. This is unique to whoever is logged into the system. You can group these by patient, by date, or by task. It's only going to show you the last 3 months into the past and 2 weeks into the future. This is kind of like your to-do list. So anything that's still pending that needs to be documented on will be found here. Same thing, here's your patient name. A for authorization, here's your task that you can click on and start straight from here. Your date, the current status of that task, any alerts for that patient, and then a missed visit form. It is important to note that whatever visits are on here, you can do a missed visit on them, but it has to be the person that's assigned to that visit to be able to complete the missed visit form. So let me click on this missed visit form. To complete a missed visit form, you can select order generated or not, physician office notified or not, whatever the reason might be, and any comments that your agency requires. Sign and date. You'll select submit. It'll go into the QA department. The other item I'd like to show you under home, you've seen my scheduled task. The other one is my monthly calendar. Again, this one is unique to whoever is logged in. You have a key here for scheduled, completed, and multiple. If you hover above it, I can see I have 1 scheduled visit on this date. I have multiple scheduled visits on this day. And if I go back into my previous month, you can see I've got a few items that have been completed. Same thing here is that you can jump into any one of the notes and start documenting. Or you can create a missed visit form. If you'd like to see what's inside of each one of these calendar days without hovering above them, you can also print. It'll create a PDF with anything you've done for the month, including physician orders, communication notes, anything that has been completed for that patient. Okay. Next, I'd like to look under View and List. You also have missed visits here that you can go through and see any missed visits that have been completed by a certain clinician or on a certain patient. You can also view different incident logs, infection logs, communication notes, and immunization logs here. Under Patients, you can go to Patient Charts. From here, you can search for different locations, whether the patients are active, discharged, pending, and non-admitted. You can filter for any particular insurance or payer types, or search for a name. Once on your patient chart, you can see you can change the photo. If you have permissions, you can edit their profile, their referral documentation. You can get more information here. You can get directions to the patient's home on Google Maps. And if you have that episode management permission underneath the scheduling management, you can see any admission periods this patient has had. To the right, you can refresh this patient's status, refresh the patient visits. You can change their status manually from active to discharged to pending or non-admitted. And you have a change in focus form. Under patient profile, this will give you a face sheet for your patient. You have an allergy profile. From here, you can select Add Allergy. Type in any medication or food, environment, plants, anything that the patient might be allergic to. And you can save and exit or save and add another. If you realize, you know what, this wasn't the right patient, I need to take this off, you can always either edit this or delete this. I'll ask you if you're sure you want to delete this allergy and you say okay. It'll bring it here, it doesn't ever completely disappear. Then you can either restore it or edit from here as well. That information will flow over to other documents within the patient's chart, like their plan of care, the episode summary, an OASIS, any notes, or medication profile. Under medication profile, you can see at the top the current episode, any current allergies, the primary diagnosis and secondary diagnosis, the patient's pharmacy and the pharmacy phone number. To add a medication, you'll select Add Medication. You can then choose between long-standing or a start date. If you choose long-standing, that start date will go away. If I go through and choose, let's put today, this DC date you should only add if there's a finite date that you're going to discontinue that medication. So typically for like antibiotics or something that's for a specific amount of days. Okay. Medications. If you start typing out your medication, you can hit search for medication and a list will drop down. You'll choose whatever dosage patient is currently on. We're going to put 1 tab. You'll choose a physician. Classifications will populate for you and you'll get the closest to whatever classification that medication is ordered for. And then I'm going to put daily for my frequency. If I type in PO, it will populate to say by mouth. And then you can choose between new, changed, or unchanged. You must select one of these boxes here. This is just saying not to create a separate order. So if it's something that's going to go on your plan of care already, depending on your agency policy, if it's already in the home and no orders required, this one will stay selected. If you need a separate order to go out to the doctor, separate from your plan of care, you'll check off this one. I'm going to go ahead and check this one off so that you can see the process. Okay, I'm going to save and exit. You can see I have a start date here, my medication, it's new, my classification, the doctor, and the date that's going to be discontinued on. If I look at this and realize I should have actually put this twice a day, I put the wrong frequency on here. I can come through and hit edit, make my change. It will default to say changed here. The other one was just an error, so I'm going to switch it back to say new. It was always this medication, and I'll put update. It's going to show up here at the bottom, the one that I updated. If I need to delete that, I can. And my current one is here at the top. You can see I accidentally deleted or accidentally added that one twice. I can delete one out of here. If you need to discontinue one, you can come through here and hit discontinue and select a date. Select discontinue. It will come down to the bottom. If you need to reactivate something, you can come back here and hit activate. You can see that medication originally started on 9/14. We're reactivating it on 9/23 for warfarin 2 milligrams. And so we'll leave it as changed and I'll select activate. You can see the old ones still stay down here. So I had warfarin 2 milligrams from 9/14 to 9/18. And then from 9/23 to no particular discontinuation date. You can add other medications such as oxygen that are not included on the list. Just note that if you cannot find them through the search, you cannot do a drug interaction. So if I search for this medication, it's not going to populate anything. So make sure you're spelling your medications correctly. If I want to go through and sign my medication profile at this point, I'll get a warning saying that I cannot sign my medication before looking at the interactions. I'll select drug interactions. If you'll notice that oxygen is not listed, even though it is on the med profile, it's not listed here because I cannot run drug interactions on something I free type in. I'll select all and hit check interactions. You can see any minor, moderate, or major interactions, and then follow your agency's protocol on what we need to do for that. I can then sign my medication profile since I've made changes to the medications. Shows all medications here, including that oxygen. Gives it an acknowledgement statement here. I've reviewed all the listed medications for potential adverse effects, drug reactions, including ineffective drug therapy, significant side effects, significant drug interactions, duplicate drug therapy, and non-compliance with drug therapy. You can sign and date and select sign. Now that that order has been, or not, now that the med profile has been signed, it'll create an order for you. This pop-up comes up and says medications have been added that requires a physician order. Click here to create order. You can select create order, and this will bring me into my order section. At the top, you have an episode. You can change your episode if needed. You can choose no physician signature required if you have the permissions for that. You can copy an additional doctor to send to this order to. You can change the date, the time, or the effective date. Notice that it will go through and default to the current date and time. You can choose if an order is for the next episode. So maybe for a lab or something that they tell you to recheck in 2 months. That'd be a good example of when you would use that. You will need to add some kind of summary or title. You can choose different order types between medication orders, plan of care orders, wound care orders, discipline frequency, supply manager, and other. Other, just take note, this is kind of like a narrative or free text option. I don't have to choose any of these at this point because my medication has already free flowed over here. So you're never going to have to retype it or duplicate that documentation. It's already going to pull over. because I had check marked that box on when I was adding that med. I can choose if the order was read back and verified. I can put a time on it, sign and date, and then hit create order. Order has been completed and it's pending QA review. You can also print the medication profile. You'll see any active and discontinued medications. And you can see any previously signed medication profiles. You can see here on 9/14, this patient only had 3 medications. They are all active. Versus today, all of your active medications, you had 5. Next, you have an immunization profile. You can add an immunization. You can choose flu, pneumonia, shingles, or other. You can choose who it was administered by and the date it was administered. You can save or save and add another. If this flu is no longer applicable, like maybe this is from 2 years ago or something like that, and it's not active now, you can come through here and inactivate them. And they'll come down here to the bottom. If you wanted to go through and show a declination or contraindication, you can select this box, choose either flu or pneumonia, the date that it was documented on, so the date that they're telling you, I'm not taking this. You can choose their declination and choose the reason. You can choose contraindication and get a different set of reasons. When you save this, you'll have a red sticky here that tells you why they either declined or it's contraindicated. Again, this information will flow through to other documents on the patient's chart. Next is an infectious disease profile. Here you can access a COVID-19 screening, an infection log, or access any COVID-19 resources. When you select a COVID-19 screening, you can choose between the patient, a household member, or a non-agency caregiver. You can choose if they refuse the screening. You'll answer a few simple questions. And if they live in a area for low risk or high risk. You can create a template if you'd like your agency to use a template in this section. You can add any additional comments here. And you can select that you've screened the above selected person prior to providing care, and that agency policy and procedures were followed to prevent the spread of COVID-19. You can go through here and sign, date and time, and sign screening. You can also add an infection log. At the top, you choose your episode, the date of infection, if the physician was notified or not, if the infection is within 72 hours of admission, or if it's after 72 hours of admission, if a chest x-ray or culture had been completed, or an antibiotic prescribed. If you need to add new medications, you can do so here. Not needed. We already added it on our medication one. And we'll put that they had augmentin. Whatever your agency is asking you to document there. Under types of infection, anywhere that does not have a colon after it is just the one checkoff. However, if you do choose something with a colon behind the wording, if you select it now, you're going to have different responses to answer. You'll have additional questions. You have a link for CDC here. If I hit CDC reportable diseases, it'll open up a CDC page and tell you what all is required to report. If you do know that they have a disease that you need to report, you can select this box here, choose which one it is, or choose other. And you can put who you contacted. Next is infection control. Choose off which infection control processes you followed. Any templates you'd like to add. And then follow-up is for when they're done with your antibiotics or side effects or symptoms of your infection. So I may not know this on this particular visit. I'll have to wait until my discontinuation of that antibiotic to answer any follow-up questions. It will not let me complete this until I have follow-up. So from here, I'm just going to hit save, and it'll go into my my scheduled task into my pending list of documents to complete. And then the COVID-19 resources will take you to our help page. Authorization listing will give you any authorization listings on this patient. You have pre-admission notes. Any notes on this patient prior to admitting the patient will populate here. Any notes on this patient that were added prior to admission will populate here. I'll hit add new note. You can always come in and add them at this point on this patient. The patient's already admitted, but you can hit add new note and add anything needed. Take 2. Authorization listing. Any authorizations listed for this patient will populate here. Any notes that were added to the patient's chart prior to them being admitted will be on this list. You'll be able to view if they were here. You have communication notes. Any communication notes that have already been added for this patient would be here. You can also add a new communication note. Here you'll go through and select your patient episode. Select your patient episode. You'll choose a date. The physician is an optional field. Do not have to answer that part. You can choose a template. Whatever template you might need. And then you can also select to send as a message or a HIPAA compliant email within your agency. You'll select that and then select whoever you are wanting to send it to. You'll sign it, date and time, and then select complete. You can still then see that sitting here. You'll be able to select the printer button and be able to view it. You can edit, or if you have permissions, delete. Next is your orders and care plans. Here you can view any orders that have already been documented. You have an order number, the type, whether it's a physician order, a plan of care, or face-to-face, what the current status is, so if it's submitted to QA or saved or already sent to the doctor, who the doctor is, if that doctor supports electronic signature, what the order date was, sent date if it's been sent to the doctor, if not, it is blank. Received and received by are both blank until it's been completed. You can come through and print any order or delete if you have that permission. Under Plan of Care Summary, once your care plan has been created and finished, you'll see any frequency and duration orders, medication orders, and skilled nursing orders, wound care orders. If any physical therapy or other disciplines would also be included. You can also toggle, these are all current orders, you can also toggle to any discontinued orders or change episodes. You can print from here or select the X to the top right-hand side to close. On episode summaries, any episode summaries are automatically created by the system will populate here, but you can also go through and create one on your own. So this is going to auto-generate at a transfer point, a discharge point. Once you do your research, you'll have an end of episode 1, as well as an intra episode in the middle of your episode. You have a Learn More button here to take you to the Help Center, and a short, quick video if you'd like to watch that here. You can create an episode summary and choose whichever one you would like to see and hit Save. And it will pull any information that's currently in this patient's chart. So here you can see which type of episode summary it is, the clinician, a date, the signature date. It's automatically going to populate the current date that you run that on, the episode date, and who the physician is. I can hit the printer button here. And be able to go through and review all of the information. So you can see the patient's information, the agency's information, the payer, who the clinical manager and case manager are, who the attending physician is, your home health dates of service. So you have a start of care date, the episode start date, episode end date, and then the first date of the episode that something was documented on. So currently on this patient, I only have the start of care documented. So I have the first date and the last date are both the same. Any emergency contact information, advanced care plan, emergency preparedness and allergies, the primary diagnosis, any medications, whether they're new or changed, they'll be marked here. What your discipline frequency is, what visits have actually been completed. So I've only completed the start of care so far. And the date of the last visit documented. Your reason for home admission to home health and continued services. This is anything on the OASIS that they chose medical necessity for. Any interventions, any goals, and then whether or not those goals have been met or unmet at this point. Tells you in nursing has a total of 8 goals and 0 goals were met. 8 goals were unmet for a goal attainment rate of 0%. It'll also give you vital sign ranges. Since I've only documented on the start of care, the low and the high are the same. Next, you have vital sign charts. Anytime that you go through in the last 7 days that you've documented on vital signs, it would be listed here and on the graph. You can scroll to the bottom and see a total of any vital signs that have been documented on. Or you can switch at the top to your vital sign logs. From here, you can see anything more than the past 7 days, as well as you can come to the top here and switch out your patients. So if you have a doctor that wants to see all of their patients' vital sign records for the last 6 months, you could go up here and switch out your dates and your patient, select refresh, and all the vital signs would populate. You can export it to Excel. Next on the quick reports list is the wound history. Any wounds that are documented on this patient, including the pictures, will populate here. You have a triage classification. Here, whatever you put for their triage will populate. You can't change it here, but you could print it for your patient. And then if you have the role to be able to delete a task, you will also have a deleted task document history so that you can restore any of the tasks that were previously deleted. Next, to the top left, we'll see New. Under the New tab, you can choose a new order, you can create a new authorization, aid care plan, or communication note. Under Order, we saw this under medications a moment ago, but let's review it again. You can associate a particular episode. Doctors, if you have the permissions to select no physician signature required, you can do that there. It will default to the current date and time. However, those are can be edited if you need them to. You can choose if the order is for the next episode. You will have to enter some kind of summary or title text. You can choose medication orders, and this will open up your medication profile for you to add or discontinue medications. You can choose plan of care orders. Here you can add a new problem statement. Select the problem statement. Select any interventions or any goals. Again, you'll have to remove the asterisks for the red to go away. That will make it patient specific. And choose Save and Exit. And Save and Exit again. You'll see down here that added what I just entered here. It'll add the interventions to it. You can choose any wound care orders. You'll add a new wound care order, create your wound care order. You'll fill in the blanks here and you'll be able to duplicate if you'd like. You'll have to associate those in the wound care manager. We'll see that on a separate video. You can add discipline frequency. Here you have the option to replace existing frequencies for all disciplines. That's very important to note, is it will replace for all disciplines. To change the frequency for the selected discipline, enter the frequency start date under frequency change order and map out the frequency for the remainder of the episode. So here, if I wanted to start my new frequency here, I can say for 1 week. If I put 1 week 9, I'm going to get a red box around here because I don't have that many visits left, that many weeks left here, because my started care started on 9/14. Okay, I can go back and put 1W8, and it'll allow me to do that. If I needed to put effective the week of whatever date or something to that nature, or maybe I just need to add some PRN visits even. If I wanted to put 3 PRN, I can come down here and put 4 wound care. And that'll populate that right underneath my 3 PRN. If I needed to add supplies, I can put supply manager. It'll be a free text box here. I can type that in. And then other is for more of like a narrative, anything that happened, right? So you can say call MD office, spoke Jessica, and received new orders. I can choose order read back and verified. Choose a time and a date, and then I can choose create order. Physician order has been saved and completed successfully. If I wanted to go back and review that order, again, I can filter here for orders and be able to view that order. That was that medication order we did earlier. Let's see here, this one and saved. If I wanted to view that order again under the quick reports here, you can select orders and care plans. Be able to view the orders. Here I can see my frequency change. Nursing 3 PRN effective from 9/23, and it's for wound care dressing changes. And here's the extra order I added. And then here's that narrative still. Again, under the new tab, you still have authorization if you need to add authorization, an aid care plan, or a communication note. You have a PDGM dashboard if you have permissions for it. You'll have any alerts here for your patients. You can see a plan of care summary or a plan of care. You can view any attached documents on this patient's chart from here. You can see I'm currently looking at the first 30 days for this patient. You can see the episode, the started care, length of stay, episode amount, so how many episodes has this patient had, days into the current episode and what the payment period is. You'll see if they have any infections, incidents, wounds, hospitalizations, or vital signs that are out of parameter. You can see if there's been any missed visits. If I had a supervisory visit that's over 14 days, if it was an outlier or a LUPA, if they are at risk for a LUPA, you can see how many visits are scheduled and how many more visits are required to avoid a LUPA here. There's a link to your 30-day calendar. You can see I have 5 out of 7 outcomes that can improve. I can see my HERG scores here, as well as my LUPA threshold, expected payment, and actual payments. I can see my cost analysis and any supplies. Then I can see frequencies ordered. Back on my patient tab, my patient chart. Under documents, anything that has been scanned into the patient's chart, such as the referral information, would populate here. You have a key here that will tell you what each alert means. So yellow for visit comments, blue for episode comments, red for missed and returned comments. To the bottom, the first column is for authorization. You have task, schedule date, assigned to, status, any electronic visit verification information, any of the alerts. You have a print option. If anything is attached to the patient's chart, you'll find it in this column here. And if you have permissions, you'll also have a menu item here under action to allow you to get into the patient's visit and change maybe a scheduled visit date or an actual visit date, add attachments, that sort of thing. You can view these by all. You can sort them out by orders, nursing, different therapies, or other disciplines. You can also change the date range of the visits that you're seeing. It will default to the current episode date. Again, by clicking on the task itself or the header bar here, it's going to put them in ascending or descending order. And then you can check on any one of the visits and be able to start your visit documentation. So I'm going to choose today's skilled nursing visit. Across the top, this is information that is pulled over from your OASIS. So this patient on the OASIS was not a DNR, a do not resuscitate. However, they were a fall risk and a hospitalization risk and infection risk. You can't do anything by clicking on these buttons, but they're just alerts to let the user know that there's what's going on with the patient. You can view your plan of care summary. We saw this out on the quick reports part. Any current orders, as well as discontinued orders. You can view the plan of care. You can also change this to a different G code. So if you had a payer that maybe wanted a different G code, you could title it a different one and make it a custom. It will not change what the note looks like on the inside. So it still says skilled nursing note here. However, the type of visit itself changed here, as well as the G code on the background that'll go over to your claim. Under previous notes, if you have the permission to view previous notes, you can select this and then select any note that has been completed already. It'll ask you if you're sure you want to load that visit. You can select OK. It will not load the vital signs, the pain, or last bowel movement. From here, you can go through and choose your time. It'll round to the first 15 minutes, but if you need it to be exact, you can come in here and maybe choose 25 and free text. You can enter a travel time in and out if your agency requires that, as well as an associated mileage or surcharge, and the date of the last visit. You'll have your primary and secondary diagnosis listed here. You can select the blue book here on the side for additional teaching guides. When you select this, it'll open up Medline Plus for you to be able to copy and paste or print out any information there for your patient's teaching. Moving on to vital signs, you'll come in here and enter your vital signs. You can, on some of these as well, choose to expand. So if I wanted to have more than one pulse, I could do so. Okay. And then choose whatever the pulse is. On blood pressure, you can switch between left and right or expand your positions. You can add weight and height if ordered. You can check mark off if you needed to, if you couldn't collect the vitals. And then additional measurements here, if you select this, this is where you'd find your blood glucose or hemoglobin A1C or MAC information here. You can hit save and close. If something's been out of range, you can select physician notified if parameters out of range or clinical manager notified if parameters out of range. You can see that most of this information already pre-filled from our previous note. One thing I would like to notice again is that if you have a colon behind any option, it will ask for additional information. Another response will be required. However, if you choose something that does not have a colon behind it, you'll just check mark it off and it'll be done. You'll have to select the last BM date. Scrolling down, the next section you have is genitourinary, you have musculoskeletal, integumentary, and pain profile. If there is a wound, they will have to click on this and add the documentation for the wound before they can close the note. They can also enter a new wound location. They can add a new photo. Moving on, it already shows you the associated order and wound care. If wound measurements are needed, you can select yes and add the wound measurements, or no and state why, whether they're not yet due or the patient refused. Under tissue type, make your selection. Skin. If there is any wound drainage, if you select yes, you'll have additional responses. No will stay. If you have wound order, again, additional responses. Wound pain. If there is any change in the wound type or any signs and symptoms of infection. You can add additional comments here and then choose how the patient tolerated the procedure, if the caregiver is able to perform, or if the patient is not adherent to certain orders. When you're done, you'll select complete. Now, if you have any questions on these, we will go through this in detail for a wound management video. But you also have a toolbox here. It'll show you some more resources about wound care. Learn more, I'll take you to the Help Center. And if you select watch, there's a few videos that you can watch here. None of them are over 5 minutes long, so they're very quick, easy videos. And then we're going to select complete. It will then turn green with a check mark on it. You can ask if the patient has had pain this week. Again, if you say yes, you'll have additional responses required, and no, you'll move on. So I'm going to select yes, and we'll put to the right knee. Keep with the Same patient information here. Activity with interferes with activity, and we'll say yes. Current pain intensity, put a 4. Past week pain intensity, best or least. We'll put very mild for that one. And then the worst, we'll put very distressing. And this is multi-select for the description here. So I'm going to put aching and sharp and throbbing. Any nonverbal pain cues, we'll put that he's grimacing. Pain is relieved or mitigated by, and let's put heat, massage, rest, medication. Current pain management effectiveness. He had an improvement in mood and improvement in physical function. And if there's any aberrant behavior noted, you can select those. Current frequency of pain interfering with the patient's activity or movement. And we'll say less often than daily on that one. And you can add any comments you'd like. Each section has a comment box. Moving on, you have the endocrine section, nutrition, labs, and infection control. Under nutrition, we had any labs here, and it's going to help prompt you to document compliance. So even like, let's take this blood test obtained example here. Venipuncture, what gauge needle? How many of attempts? Except right antecubital. And they tolerated well. Here to the right, you have infection control. If you click this COVID-19, it's going to take you to our Help Center to the COVID-19 resource page. You can say whatever precautions you observed here. If you suspect a new infection or they've been diagnosed with a new infection, you have the opportunity to create an infection log like we saw earlier, or another COVID-19 screening, so infectious disease profile. Moving on under homebound status. Moving on under homebound status. You'll see that you already have homebound information added here. This came over from your OASIS. However, the clinician is able to go through and change it. You have a plan of care review and who you revise that plan of care with. If your patient is willing and able to participate, if your caregiver is involved, and what their availability is, and if any orders are have been changed or new on the plan of care. You have discharge planning, core care coordination. You can go through and add an incident log here, or add a communication note here. Under health management, the first box to your left is your review medication profile. It is blue until you select your medication profile, you review what's on here, and get out of there. Now it turns green with a check mark saying you've at least reviewed your medication profile. You can say your medications are reconciled or whatever else is going on with your medications here. Next is orders for discipline and treatment. You can see that my narrative pulled over from my previous one. So it looks like they taught on hospitalization last time. I'm going to go ahead and just completely clean out what I taught on my last visit. And under plan of care, I see all my problem statements. I'm going to select alteration, comfort, pain. And I can see here what the intervention is that was included on the OASIS and what else was on the goal included on the OASIS. Here I can say document. It tells me it's been added to my visit note. And then I can select document on the goal that's now been added to my visit note. If there's some kind of goal that I completely resolve, I can also go through and resolve the goal. It will when I resolve the goal. Once all goals have been resolved for each problem statement, it will resolve all the interventions as well. Here I can see that what I clicked on and said document to will automatically populate in my note. You can then go back and change it. So if you wanted it to be past tense, you can maybe say SN instructed patient and caregiver regarding strategies to mitigate pain, including medication administration and so on. Here you can have your goal here and maybe say that patient was unable to obtain this right now. Okay. Whatever you'd like to type into that. Your medical necessity comes over from your OASIS as well. You can add a narrative here. Under Edit Supply Worksheet, you can add a new supply. Of course, you're going to want to choose from your drop down. Say what your quantity is and what the date is and select Insert. I can go back and add another if I'd like. And Insert. You can perform a supervisory visit. If I select this and I am an RN with scheduling privileges, I must be able to have that first scheduling privilege on my permissions. Then I can choose to create a supervisory visit, so one does not have to be scheduled out to me. It says schedule and open a note. So you must have that scheduling privilege to be able to complete that task. That supervisory visit at this time is only available on the web browser version, not on the mobile app. If I hit schedule and open a note, it'll tell me if any of my policies or any of my HR information is about to expire or has expired. I can select the clinician, whether or not they're present on the visit date, any associated mileage, the date of their annual on-site supervisory visit, and then I can go through and answer the questions here. Scrolling down. Is this patient high risk for hospitalization readmission? Can add any templates here. Sign. Date. And time. And then complete. Now my LVN supervisory note is completed and it takes me back to my skilled nurse visit. If you need to make adjustments to your aid care plan, you can select Add Edit Aid Care Plan. On the OASIS, we already added one, so that's why all this information is populated. If you needed to make a change, you would add and replace the old care plan. That includes our skilled nursing note, so let me sign here. Date and time, and select Complete. Complete will submit it to QA. On our last call, we went over the home health aid care plan. Let's look at those home health aid visit notes now. Here again, same thing at the top. You'll see any alerts. You can see an aid care plan. You can see that the home health aides are not allowed to document in the future. They can go back and change it to a past date or a current date, but nothing in the future. Go in and put a time in and time out. Travel time if required by your agency and associated mileage. surcharge. You'll see their primary and secondary diagnosis, as well as your case manager and their frequency, any other services in the home, any infection precautions listed on the aid care plan, or any special considerations, anything to report. You can notice I can't make any changes on anything that is here in gray. It's just for information for the home health aide. You can also see their vital sign parameters. You'll see each task has a red asterisk near it. That means it is a required field. They'll only be able to see the tasks that were listed on the aid care plan. They will need to go through and put completed or refused on each task. So if they choose completed, and I'm looking at the temperature, pulse, okay, shower with chair. I'll say they went in and did all this. You can also see it says give shower in the morning for as a comment that was on the aid care plan. Assisted toilet, we'll say maybe today it wasn't needed and we recorded the last BM date. So you can see here you have to either choose completed or refused, or if it is a weekly task instead of an every visit task, you will also have the option for NA. And a medication reminder. Case manager notified of any problems or concerns. They can choose infection precautions followed. They can add any comments like the last BM date. They can add a communication note. They'll sign, date, they'll enter a time, and complete. This note was successfully submitted to QA. Last, let's go through and look at a therapy assessment/evaluation. Whether it's physical therapy, occupational therapy, or speech therapy, the notes are set up the same. We chose physical therapy for this patient. Same thing across the top. You'll see the alerts for your patient. You'll be able to view a summary, a plan of care, change your G code, or view previous notes here. You'll have the date, the time. If your agency requires them to add a travel time in or out, the associated mileage or surcharge. They can choose a date of the last visit by the physician. They will have the primary and secondary diagnosis as well as a blue book to take you into Medline Plus for additional teaching guidelines. And then therapy diagnosis if they wanted to add a therapy diagnosis. They'll enter in the vital signs here. Okay. That's it for this page. So we're going to move on to the next one. You'll see that some of this has already pulled over from your OASIS, including this patient living situation. This is to help collaborate between disciplines. So on my note here, I can see at start of care, whoever did the start of care put that this patient lives with another person in the home that provides regular daytime assistance. If I knew that this patient actually has around the clock assistance, I can make this change here so that when I print out my note, it will tell me around the clock assistant. However, that will not change your OASIS. So at this point, you'd want to pick up the phone and talk to your clinician who did the start of care and let them know, hey, there's actually someone who lives with them that provides around the clock assistance, so that if they wanted to make that change on the OASIS, they could. This will print out on your note. So if you make a change here, that's the only place that's going to affect anything is on the note itself. I can hit save and continue, or I can click through the tabs here. So you have a physical assessment, so you can choose here whether they're independent or not. You can put apply to all, and then still go through and make changes to 1 or 2 or 3 of those. You have prior therapy received. You have current level of function. You have a neurobehavioral status. So it does not pull over from the skilled nursing notes or the OASIS for any of this assessment part. You have a GU and GI. You have sensory status. This pulled over from your OASIS. You do have one active wound. It's not going to let me close this without at least acknowledging it. So if I choose one active wound here, it's going to open up my wound manager. If I was not performing the wound care, I can choose care not performed because it's not ordered on this visit. And then I can hit complete so that it'll show me that I at least reviewed it. Under pain status, everything from beforehand pulled over, everything from the OASIS pulled over. Then you can go through and make any adjustments as needed. I can save and continue. Under your manual muscle strength or upper, you have lower, and then you have test comments. If you're not sure how to grade these, you do have this little key here that says manual muscle strength grading chart. So you can see we use the Medical Research Council. If you're used to a Daniels and Worthingham or a Kendall and Mercury, it's here. And then it tells you the explanation. So if I choose a 5, that means the patient can hold test position against maximal resistance versus a 0 saying no palpable or observable muscle contraction. You can come in here and choose a score. And then you can choose the right, the left, or both and apply. And it'll do it all the way across the board. Again, you can choose 1 for one side. And you can choose something different for the other side. It's going to go through every system in the upper and in the lower. So this top one was for my shoulder. I have elbow, forearm, wrist, and finger. And then on this side, I have hip, knee, ankle, foot, and trunk. Again, I can add any comments as needed here. Under functional assessment, I'll have bed mobility, transfers, wheelchair mobility, gait analysis. I can say level of assistance here. I can say independent or standby assistance, moderate assistance up to 50%, whichever one applies for your patient, and then you can apply all and still be able to go back and make changes to whichever one is needed. You can add templates or comments. Same thing here on transfers and wheelchair mobility. Your gait analysis here. And you can say on this one, you'll say standby assistance for up to 10 feet. Unlevel, we didn't try it, and stairs and steps, we didn't try. You can go through and put any gait quality or deviations here. Any assistive devices. Any templates. You have a balance sitting. Standing, weight bearing. You can say partial weight bearing. posture, endurance. Make any kind of comments here. It'll tell you to explain how limited endurance is impacting the patient and preventing quality of life, and what and how improving patient's endurance will impact care and life. So it's going to give you hints to document appropriately. Next, you have a therapy toolbox. If you select this therapy resource link, it's going to give you other resources for home exercise programs and how to complete those. You have several different standardized tests here. You have a tug test or a time get up and go test, a Tianetti, a Berg, functional reach. I think those are the ones I probably see the most. If you go through and click on them, it will open these up and you can do these assessments right here in the system. And you'll see it's adding it as I go. So here's my total balance score, plus for this particular test, it has a balance and a gait score. So here I can go through and answer for both. And it'll tell me my total gait score is 10 with a combined total score is 23, so it's a moderate risk for falls. You can enter analysis from data from test and how it relates to the need for therapy and formulation of the plan of care. These next two sections here are OASIS functional status and OASIS functional abilities. This is going to really depend on your agency and what you would like them to do and how your process will be. Whatever changes are made here will not flow back to the OASIS. This is more to let you know at the start of care what the start of care clinician put on their OASIS. So it's just collaborating care. If I make a change here, it makes 0 changes to my OASIS. These two sections, when printing the physical therapy assessment and evaluation, will not even print on the note. So I can see at start of care that under grooming, that they said grooming utensils must be placed within reach for the patient to be able to complete the grooming activities. As a physical therapist, if I saw that that wasn't accurate or that they could do something more or less, I would want to pick up the phone and talk to the start of care clinician. This is specifically important for things such as maybe they're transferring and ambulation. You know, if the clinician at start of care accidentally maybe had a typo and put that they were bedfast, yet physical therapy is walking them 20 feet, it would pose a problem. Under functional abilities, same thing, you're able to see what was added at start of care point for a baseline knowledge and for collaboration of care. Next, you have summary of care. Here, similar to the skilled nursing note, you have an infection control section. They're able to add an infection log. You have a care coordination section that they can add a communication note or an incident log. You can recommend other disciplines here. It does not make a referral process, but it'll just be on your documentation. You have an infectious disease profile here that you'd be able to do a COVID-19 screening. Your plan of care review. If I select this, it's going to tell you who did you develop a plan of care with, and you can choose the patient selected representative or legal representative. It is multi-select, so you can choose more than one. My patient response is that they're going to be willing and able to participate. You can say they agree to the plan of care as presented. Moving down, I have patient selected legal representative response. We'll say they're able to participate and that they agree. Under visit interventions, if you instructed on safety, you can choose that and choose what all you instructed on. If you reviewed the disciplines and scheduling, and if they agreed, you would check that off, and then any physician contact information here that you contacted the physician regarding the need for therapy services and per physician orders with plan of care to follow. You can document any skilled care provided and the response to that skilled care. You can add a template if you like for here. It's a need for continued care, and it'll tell you review assessment and connect deficits to functional problems here within the narrative. Justify need for continued therapy, identify barriers to treatment plan, and potential for progression need for maintenance, therapy, or enter SOAP note. You will have the option to edit a supply worksheet, just like on the skilled nursing note, view a medication profile, or perform a supervisory visit if you have those scheduling permissions. The next tab is your plan of care. Again, everything from the Oasis is pulling over to this section. However, you can also go in and edit these responses. Your rehab potential, any discharge plans, and then you have a frequency here. You're able to show your calendar and be able to calculate that frequency out. This will give additional text verbiage behind your frequency. So let's say 3 times a week. 3 times a week for 8 weeks. And we'll say 2 times a week for 1 week. We'll notice on the frequency that it stays blue when the frequency is written appropriately in the suggested accepted frequency formats. If I were to go in here and type out 3 week 8 is a different color. So anytime, other than hovering over it, anytime that it does not stay blue, there is something wrong with the information there. If I went in there and just put eval and treat, they all sit there and turn a different color. You can see it is not an accepted format. Anything else that you'd like to type in, such as that effective date, you could do it here. So plan of care for therapy services. Do they need restorative therapy, maintenance therapy, or no visits are needed after the evaluation? If I said restorative therapy, I can still choose that need for further visits, occupational need for further visits, or speech need for further visits. I can put on here physical therapist assessed patient and developed a plan of care with patient or caregiver involvement. And it'll add that statement to my evaluation. At the bottom, this is where you're going to choose if your evaluation is going out separately or with the multidisciplinary plan of care. If you would like it to combine with other disciplines for one large plan of care, you can do that as long as it's within the right time frame. So with the Oasis on a started care, your M90 date, you technically have 6 days. The started care is day 0. So from the beginning of an episode, you have 6 days from the beginning of an episode. Or if this is completed within the last 5 days before the end of the episode, so during that research window, then you will not need to choose either one of these. You just leave it blank and turn it in, and it will pull all of the orders over to the main multidisciplinary plan of care. If it is outside that time frame, it will automatically create a separate evaluation for physician signature. You can then choose if you would like a full evaluation or partial evaluation sent. Selecting one of these, even if it is within the 5-day window, will have it go out separately on its own. So if you make a choice here, it will go out on its own, not combined with a multidisciplinary plan of care. You have the option to add wound care orders or regular therapy orders. So if I choose this plan of care profile, I can see under physical therapy, I have no active orders. I can choose add order here and select a problem statement similar to what we saw in the Oasis. I'm going to put need for physical therapy and choose add. This looks like the Oasis. I'm going to choose my problem statement. I'm going to say need for physical therapy. Physical therapy evaluation completed. Need for further visits. This is the only spot within physical therapy orders that you will have the option for medical necessity and homebound narrative. You must choose this problem statement, this need for physical therapy problem statement, to be able to add a medical necessity for physical therapy or a homebound narrative. If I choose one of these, I will still need to go through and correct any of the responses with an asterisk. I'm just going to take the asterisks off there so the red will go away. And I can also choose my homebound status. I can save and exit and add additional orders if I'd like. You can add as many as you would like here. There's plenty of different problem statements that you can choose from, including an additional for just your template if you want a free text. Let's do an alteration in pain. Alteration in comfort and pain, and you can teach on pain management. You'll also notice here that there is not medical necessity or homebound status on here. It's only in that one section. So once you've added all of your orders and goals for physical therapy, I'm going to do PT save and exit. And that created my whole plan of care profile and all the orders for physical therapy. From here, I can complete. It's going to ask me for my signature. It'll automatically put the today's date and signature time. If it was a different date than that, you can change it and select finish. Okay, here's my PT care plan of care with full evaluation. It separated it out because it was not until 9/21 versus my start of care on 9/14. It was past that date range, therefore it came out separately. I do want to take a note though, if I print out my physical therapy assessment and evaluation, that you will not see the OASIS questions except for this one. Just this living arrangement one will show up and it'll choose the one that you put on here on the evaluation, not what's on the OASIS. You can see all the responses here. You can see your therapy toolbox, your summary of care, your plan of care review and intervention, any skilled care provided or homebound status. You'll see your frequency and any comments made past that frequency effective the week of. Okay. Any orders, any wound care flow sheets. Treatment performed was NA and no comments needed. So you never saw the OASIS questions there. They were for collaboration purposes only. And you can view the plan of care. You'll see the difference here is that you'll have a physician signature on here. So this would go out for signature.